Question 1. A 68-year-old patient with chronic obstructive pulmonary disease, COPD, is admitted for a laparotomy. What is the priority nursing action to minimize the risk of respiratory complications post-surgery? A. Administer the prescribed pain medication regularly. B. Monitor the patient's oxygen saturation continuously. C. Encourage deep breathing exercises every hour. D. Ensure the patient is positioned to promote optimal lung expansion. Answer. B. Monitor the patient's oxygen saturation continuously. Rationale. For patients with COPD, oxygen saturation must be closely monitored, as they are at high risk for respiratory complications. The priority is ensuring the patient maintains adequate oxygenation post-surgery. Pain management, deep breathing, and positioning are also important, but secondary to monitoring oxygen saturation in this critical case. Question 2. During the intraoperative phase of a patient undergoing a bowel resection, the surgeon suspects accidental bowel perforation. What is the most critical action the nurse should take? A. Assist with preparing a sterile field for immediate repair. B. Notify the surgical team to ensure prompt intervention. C. Monitor the patient's vital signs for signs of shock. D. Administer prescribed antibiotics to prevent infection. Answer. C. Monitor the patient's vital signs for signs of shock. Rationale. In the event of bowel perforation, the priority is to recognize signs of shock due to peritoneal contamination. The nurse should monitor the patient's vital signs closely, especially for hypotension and tachycardia, which could indicate early septic shock. Immediate surgical intervention and antibiotic administration are crucial, but managing hemodynamic stability is the first priority. Question 3. A post-operative patient is not responding to verbal stimuli after general anesthesia. What is the nurse's immediate action? A. Administer naloxone to reverse the effects of opioids. B. Elevate the head of the bed and administer oxygen. C. Check the patient's airway and respiratory effort. D. Notify the anesthesia provider immediately. Answer. C. Check the patient's airway and respiratory effort. Rationale. The first priority when a patient does not respond after anesthesia is to ensure a patent airway and assess respiratory effort. Airway obstruction is a common cause of non-responsiveness, and prompt action can prevent further complications. Naloxone may be necessary if opioid overdose is suspected, but airway assessment takes precedence. Question 4. A post-operative patient with a history of diabetes and hypertension reports new onset chest pain. What is the most critical step the nurse should take? A. Administer nitroglycerin as prescribed. B. Assess the patient's vital signs and ECG for signs of a myocardial infarction. C. Administer morphine to manage pain and reduce anxiety. D. Ensure the patient is positioned comfortably and reassess in 30 minutes. Answer. B. Assess the patient's vital signs and ECG for signs of a myocardial infarction. Rationale. Given the patient's history of diabetes and hypertension, new onset chest pain could indicate myocardial infarction, MI. The nurse should assess vital signs and ECG to determine if there are signs of a heart attack. Pain management and comfort measures are important, but secondary to assessing for MI in this critical situation. Question 5. A patient who has undergone abdominal surgery reports severe, sudden, and worsening abdominal pain, along with nausea and vomiting. What should the nurse suspect and prioritize in the assessment? A. Bowel obstruction. B. Surgical wound dehiscence. C. Acute pancreatitis. D. Peritonitis from infection. Answer. D. Peritonitis from infection. Rationale. The symptoms of severe abdominal pain, nausea, vomiting, and a sudden onset post-surgery are concerning for peritonitis, which could result from infection after abdominal surgery. This is a life-threatening complication that requires immediate intervention. Bowel obstruction is also a possibility, but less likely to present with such sudden, severe pain. Question 6. A 75-year-old patient who underwent knee replacement surgery is at high risk for deep vein thrombosis, DVT. What is the most effective nursing intervention to prevent this complication? A. Encourage early ambulation as tolerated. B. Administer prescribed low molecular weight heparin, LMWH, prophylactically. C. Apply compression stockings to the legs. D. Ensure adequate hydration and monitor for signs of dehydration. Answer. B. Administer prescribed low molecular weight heparin, LMWH, prophylactically. Rationale: prophylactic anticoagulation with LMWH is the most effective intervention to prevent DVT, particularly in patients at high risk, such as those undergoing knee replacement surgery. While early ambulation, compression stockings, and hydration are also important, anticoagulation is the primary method for DVT prevention in this case. Question 7. A patient post-surgery is found to have a large volume of bright red drainage from the surgical site. What is the priority nursing action? A. Document the drainage and notify the healthcare provider. B. Apply pressure to the surgical site to control bleeding. C. Reassess the vital signs and check for signs of shock. D. Change the dressing and apply a new sterile dressing. Answer. C. Reassess the vital signs and check for signs of shock. Rationale: the first priority in a patient with bright red drainage post-surgery is to assess for signs of shock, which could indicate active bleeding. The nurse should reassess vital signs, particularly blood pressure and heart rate, to detect hypotension or tachycardia, which are indicators of shock. Controlling the bleeding is also crucial, but stabilization of the patient's condition is the first step. Question 8. A patient is scheduled for surgery but reports a severe allergy to latex. What is the nurse's immediate priority action? A. Administer antihistamines as ordered. B. Alert the surgical team and ensure a latex-free environment. C. Document the allergy in the patient's medical record. D. Apply a latex-free tourniquet before starting the procedure. Answer. B. Alert the surgical team and ensure a latex-free environment. Rationale: the most critical action is to prevent exposure to latex by informing the surgical team and ensuring that all equipment and supplies are latex-free. This proactive step is vital in avoiding an allergic reaction that could complicate the surgery. While documenting and applying a latex-free tourniquet are important, ensuring a latex-free environment should be the top priority. Question 9. After surgery, a patient is unable to void despite drinking fluids and being encouraged to ambulate. What is the most appropriate action by the nurse? A. Assess for bladder distension and consider catheterization if needed. B. Reassure the patient and continue to encourage ambulation. C. Administer a diuretic as ordered to promote urination. D. Increase fluid intake and wait for natural urination. Answer. A. Assess for bladder distension and consider catheterization if needed. Rationale: the inability to void after surgery may indicate urinary retention, and the nurse should assess for bladder distension. If the patient is unable to void and retention is confirmed, catheterization may be necessary to relieve the bladder. Waiting for natural urination without intervention could lead to complications such as bladder overdistension or infection. Question 10. A patient who has undergone spinal surgery is complaining of severe chest pain, shortness of breath, and a sudden drop in oxygen saturation. What should the nurse suspect first? A. Pulmonary embolism, PE. B. Myocardial infarction, MI. C. Acute respiratory distress syndrome, ERDS. D. Pneumothorax. Answer. A. Pulmonary embolism, PE. Rationale: the combination of sudden chest pain, shortness of breath, and a drop in oxygen saturation after surgery is most concerning for a pulmonary embolism, PE, which is a life-threatening condition that requires immediate intervention. The patient's recent surgery puts them at high risk for PE. While other conditions like MI and ARDS are also possible, PE is the top priority in this clinical scenario. Question 11. A 55-year-old male patient who underwent a coronary artery bypass graft (CABG) is now exhibiting signs of confusion and agitation. What is the priority nursing action? A. Administer a sedative to manage agitation. B. Assess the patient's oxygen saturation and perfusion status. C. Increase the patient's pain medication dosage. D. Contact the healthcare provider for a psychiatric evaluation. Answer. B. Assess the patient's oxygen saturation and perfusion status. Rationale. Postoperative confusion and agitation may indicate hypoxia or inadequate perfusion, especially after a major surgery like CABG. The nurse should first assess oxygenation and perfusion to rule out these physiological causes. Sedatives and increased pain medication may not be effective if the underlying issue is hypoxia or poor perfusion. Question 12. A patient who underwent colorectal surgery is now showing signs of hypotension, tachycardia, and oliguria. What should be the nurse's immediate priority action? A. Administer an intravenous fluid bolus. B. Start the patient on vasopressor therapy. C. Notify the surgeon of the symptoms. D. Assess the surgical site for internal bleeding. Answer. A. Administer an intravenous fluid bolus. Rationale. The signs of hypotension, tachycardia, and oliguria suggest possible hypovolemia or shock. The first priority is to restore intravascular volume by administering an intravenous fluid bolus. If the patient's condition does not improve, further interventions such as vasopressors may be required, but fluid resuscitation is the first step in managing shock. Question 13. A 70-year-old post-operative patient with a history of congestive heart failure, CHF, presents with crackles in the lungs, a productive cough, and decreased oxygen saturation. What should the nurse suspect as the most likely cause? A. Acute myocardial infarction (MI). B. Post-operative pneumonia. C. Pulmonary embolism (PE). D. Acute exacerbation of CHF. Answer. D. Acute exacerbation of CHF. Rationale. The patient's history of CHF, along with symptoms such as crackles, a productive cough, and hypoxia, suggests an acute exacerbation of CHF, likely due to fluid overload. Post-operative pneumonia, PE, and MI are all possibilities, but the patient's history and symptoms are most consistent with CHF exacerbation. Immediate intervention to manage fluid balance and optimize heart function is critical. Question 14. A patient is scheduled for a left-sided mastectomy and reports a history of severe allergic reactions to contrast eye. What is the nurse's priority action? A. Notify the surgical team and ensure an alternative imaging plan is in place. B. Administer an antihistamine as prescribed to prevent an allergic reaction. C. Complete the preoperative checklist and document the allergy. D. Inform the anesthesia team to prepare for an emergency airway management. Answer. A. Notify the surgical team and ensure an alternative imaging plan is in place. Rationale. If the patient has a known allergy to contrast dye, the priority is to ensure that no contrast dye is used in imaging procedures. The nurse should inform the surgical and anesthesia teams to plan accordingly and prevent exposure to the allergen. While antihistamines and airway preparation are important for managing allergies, preventing exposure to the allergen is the first step. Question 15. A 45-year-old patient is recovering from a hip replacement surgery and develops a sudden onset of shortness of breath, chest pain, and anxiety. What is the first action the nurse should take? A. Administer supplemental oxygen and notify the healthcare provider. B. Perform a deep vein thrombosis (DVT) assessment. C. Administer a sedative to reduce anxiety. D. Assess for signs of pulmonary embolism (PE) and notify the provider. Answer. D. Assess for signs of pulmonary embolism (PE) and notify the provider. Rationale. The patient's sudden shortness of breath, chest pain, and anxiety are classic signs of a pulmonary embolism (PE), a serious post-operative complication, particularly in patients undergoing hip replacement. The nurse should immediately assess for PE and notify the healthcare provider for further intervention. Administering oxygen and assessing for DVT are also important, but secondary to ruling out PE. Question 16. A 30-year-old patient post-surgery is refusing to ambulate due to pain, despite the prescribed pain management regimen. What should the nurse do next? A. Continue to monitor the pain management plan and reassess after an hour. B. Offer a higher dose of pain medication and encourage ambulation. C. Assess the patient's understanding of the importance of ambulation and offer support. D. Contact the surgeon to discuss alternative pain management options. Answer. C. Assess the patient's understanding of the importance of ambulation and offer support. Rationale. The nurse should first assess the patient's understanding of the importance of early ambulation for preventing complications such as DVT and pneumonia. Providing education and offering support, such as help with positioning or assistance during ambulation, may help alleviate anxiety and pain. Reassessing the pain management plan or increasing medication may be needed if the patient continues to refuse. Question 17. A post-operative patient with a history of diabetes mellitus is found to have a blood glucose level of 300 milligrams per deciliter. What is the priority nursing action? A. Administer insulin as prescribed and monitor glucose levels. B. Notify the healthcare provider of the elevated blood glucose. C. Encourage the patient to drink fluids to reduce glucose levels. D. Reassess the patient's blood glucose in 30 minutes. Answer. A. Administer insulin as prescribed and monitor glucose levels. Rationale. The priority action is to administer insulin as prescribed to bring the elevated blood glucose under control. Uncontrolled hyperglycemia post-surgery can impair wound healing and increase the risk of infection. Monitoring glucose levels closely is essential to ensure adequate management of diabetes in the postoperative period. Question 18. A patient recovering from abdominal surgery develops a fever and reports increased pain at the surgical site. What is the nurse's priority intervention? A. Administer an antipyretic and reassess the patient's vital signs. B. Assess the surgical site for signs of infection or dehiscence. C. Increase the patient's fluid intake to promote healing. D. Notify the healthcare provider for further evaluation. Answer. B. Assess the surgical site for signs of infection or dehiscence. Rationale. The fever and increased pain are concerning for infection or wound dehiscence, both serious postoperative complications. The nurse's priority is to assess the surgical site to identify any signs of infection, such as redness, swelling, or drainage, and take appropriate action. While antipyretics, fluids, and notification of the provider are important, the first step is to assess the surgical site. Question 19. A post-operative patient who has received anticoagulation therapy develops a large, painful hematoma at the surgical site. What should the nurse do first? A. Apply ice to the hematoma to reduce swelling. B. Notify the healthcare provider immediately. C. Assess the patient for signs of bleeding elsewhere in the body. D. Increase the patient's pain medication dosage. Answer. C. Assess the patient for signs of bleeding elsewhere in the body. Rationale. The priority is to assess for signs of internal bleeding, particularly in the context of anticoagulation therapy. This could indicate a more widespread bleeding issue, which requires urgent intervention. While applying ice and notifying the healthcare provider are important steps, assessing the patient for additional bleeding is the first action. Question 20. A 60-year-old patient is recovering from knee surgery and is at high risk for postoperative delirium. What is the most effective nursing intervention to reduce this risk? A. Ensure adequate pain management and hydration. B. Monitor the patient's mental status regularly. C. Minimize the use of sedatives and narcotics. D. Encourage family visitation to reduce anxiety. Answer: C. Minimize the use of sedatives and narcotics. Rationale: delirium in post-operative patients is often exacerbated by the use of sedatives and narcotics. The nurse should prioritize minimizing the use of these medications while ensuring that the patient is adequately managed for pain. Regular mental status monitoring and family visitation are also important, but secondary to medication management. Question 21. A patient who underwent abdominal surgery suddenly complains of sharp, localized chest pain, difficulty breathing, and cyanosis. What is the nurse's priority intervention? A. Administer oxygen and prepare for possible intubation. B. Assess the surgical site for any sign of bleeding or infection. C. Administer pain medication to reduce discomfort. D. Assess for signs of a pulmonary embolism and notify the healthcare provider. Answer: D. Assess for signs of a pulmonary embolism and notify the healthcare provider. Rationale: the symptoms of sharp chest pain, difficulty breathing, and cyanosis post-surgery are concerning for a pulmonary embolism (PE), a life-threatening condition that requires immediate intervention. The nurse should assess for PE signs and notify the healthcare provider for immediate management. Question 22. A patient who is post-operative after a hip replacement begins to develop sudden swelling, redness, and warmth in the affected leg. What is the most critical action the nurse should take? A. Encourage the patient to perform ankle pumps. B. Apply compression stockings to the affected leg. C. Notify the healthcare provider to assess for deep vein thrombosis, DVT. D. Elevate the affected leg to reduce swelling. Answer: C. Notify the healthcare provider to assess for deep vein thrombosis, DVT. Rationale: the sudden onset of swelling, redness, and warmth in the leg post-surgery raises concern for deep vein thrombosis, DVT, a serious complication. The nurse should notify the healthcare provider for prompt assessment and management. Elevation, compression stockings, and ankle pumps are also important, but secondary to ruling out DVT. Question 23. A post-operative patient is being discharged with a prescription for anticoagulation therapy. Which instruction should the nurse provide to minimize the risk of bleeding complications? A. Increase your fluid intake to avoid dehydration. B. Be sure to avoid any vigorous physical activity for 2 weeks. C. Notify your healthcare provider if you experience any signs of unusual bruising or bleeding. D. You may stop the medication if you feel fine after a week. Answer: C. Notify your healthcare provider if you experience any signs of unusual bruising or bleeding. Rationale: patients on anticoagulation therapy are at increased risk for bleeding, and the nurse must educate the patient to be vigilant for signs such as unusual bruising, prolonged bleeding, or bloody urine. Fluid intake and avoiding vigorous physical activity are also helpful, but bleeding signs are the priority. Question 24. A 45-year-old post-surgical patient with a history of hypertension develops a sudden increase in blood pressure, severe headache, and blurred vision. What is the nurse's most critical action? A. Administer an antihypertensive agent as prescribed. B. Position the patient in a high Fowler's position to reduce intracranial pressure. C. Assess the patient's neurological status and monitor for signs of a hypertensive emergency. D. Notify the healthcare provider and prepare for a CT scan. Answer: C. Assess the patient's neurological status and monitor for signs of a hypertensive emergency. Rationale: the symptoms of severe headache, blurred vision, and elevated blood pressure suggest a hypertensive emergency, which can lead to life-threatening complications like stroke. The nurse's priority is to assess the patient's neurological status to detect any signs of organ damage. Question 25. A patient post-surgery who has received a narcotic analgesic is found to be unresponsive with a respiratory rate of 6 breaths per minute. What is the nurse's immediate action? A. Administer naloxone as ordered and assess vital signs. B. Reposition the patient and monitor respiratory effort. C. Provide supplemental oxygen and reassess in 30 minutes. D. Notify the healthcare provider for further orders. Answer: A. Administer naloxone as ordered and assess vital signs. Rationale: a respiratory rate of 6 breaths per minute in a post-operative patient who has received narcotics suggests opioid overdose and respiratory depression. Naloxone, an opioid antagonist, is the immediate intervention to reverse the effects of the narcotic. After naloxone administration, the nurse should reassess vital signs to ensure recovery. Question 26. A patient recovering from abdominal surgery has a sudden drop in blood pressure, an increased heart rate, and decreased urine output. What is the nurse's first priority? A. Administer intravenous fluids as prescribed to restore blood volume. B. Assess the surgical site for signs of internal bleeding. C. Increase the patient's pain medication to relieve distress. D. Notify the healthcare provider immediately for further intervention. Answer: B. Assess the surgical site for signs of internal bleeding. Rationale: a sudden drop in blood pressure, tachycardia, and oliguria after surgery suggests hemorrhagic shock. The nurse should first assess the surgical site for signs of active bleeding, as this is the most likely cause of the patient's symptoms. Fluid resuscitation and pain management are also important, but secondary to identifying and controlling the source of bleeding. Question 27. A post-surgical patient is experiencing nausea and vomiting despite receiving antiemetics. What is the nurse's next best step? A. Administer additional antiemetics as prescribed. B. Reassess the patient's abdominal status for signs of complications. C. Encourage the patient to drink clear liquids to prevent dehydration. D. Notify the healthcare provider immediately. Answer: B. Reassess the patient's abdominal status for signs of complications. Rationale: persistent nausea and vomiting after surgery may indicate complications such as bowel obstruction, ileus, or gastric distension. The nurse should reassess the abdominal status for any signs of these complications, such as bloating, pain, or changes in bowel sounds. Additional antiemetics may be helpful, but should be secondary to ruling out serious complications. Question 28. A patient is recovering from a mastectomy and reports significant arm swelling. What is the most important nursing intervention? A. Apply compression stockings to reduce swelling. B. Assess the patient's arm for signs of infection. C. Elevate the affected arm and recommend gentle range of motion exercises. D. Notify the healthcare provider to consider further diagnostic tests. Answer: C. Elevate the affected arm and recommend gentle range of motion exercises. Rationale: post-mastectomy lymphedema is common, and elevating the arm helps reduce swelling. Gentle range of motion exercises can promote lymphatic drainage and prevent further complications. Infection should also be assessed, but the priority is managing the swelling through elevation and movement. Question 29. A 70-year-old patient with a history of stroke and chronic kidney disease develops sudden shortness of breath and jugular venous distension, JVD, post-surgery. What should the nurse suspect? A. Pulmonary embolism, PE. B. Acute heart failure exacerbation. C. Hemorrhagic shock from internal bleeding. D. Atelectasis due to post-operative immobility. Answer: B. Acute heart failure exacerbation. Rationale: sudden shortness of breath and JVD in a patient with a history of stroke and chronic kidney disease are concerning for acute heart failure exacerbation. This condition can be triggered by surgery, fluid overload, or medication changes. The nurse should assess the patient's cardiac and respiratory status and initiate interventions for heart failure management. Question 30. A post-operative patient is receiving a PCA, patient-controlled analgesia, pump for pain management. The nurse notices that the patient is frequently pressing the button for more medication, but is not getting relief. What is the priority action? A. Increase the PCA dosage to provide better pain relief. B. Assess the patient for signs of opioid tolerance or overdose. C. Notify the healthcare provider to adjust the PCA settings. D. Monitor the patient closely for side effects of the medication. Answer. B. Assess the patient for signs of opioid tolerance or overdose. Rationale. Frequent pressing of the PCA button without relief may indicate opioid tolerance or a mechanical issue with the PCA pump. The nurse should first assess for signs of opioid overdose, for example, respiratory depression, and investigate the functionality of the PCA device. If needed, the healthcare provider should be notified to adjust settings or provide alternative pain management. Question 31. A post-operative patient who underwent a total knee replacement presents with sudden shortness of breath, tachycardia, and a drop in oxygen saturation. What should the nurse suspect first? A. Pulmonary embolism, PE. B. Pneumothorax. C. Acute myocardial infarction, MI. D. Acute renal failure. Answer. A. Pulmonary embolism, PE. Rationale. The sudden onset of shortness of breath, tachycardia, and a drop in oxygen saturation is highly suggestive of a pulmonary embolism, PE, especially in a post-operative patient. PE is a common and life-threatening complication following surgeries like knee replacement. The nurse should assess for PE and notify the healthcare provider immediately. Question 32. A 60-year-old patient post-cardiac surgery develops significant swelling and redness in the lower extremities. What is the most likely cause of these symptoms? A. Deep vein thrombosis, DVT. B. Acute myocardial infarction, MI. C. Cellulitis. D. Fluid overload. Answer. A. Deep vein thrombosis, DVT. Rationale. Post-cardiac surgery patients are at high risk for deep vein thrombosis, DVT, due to reduced mobility. Swelling and redness in the lower extremities are classic signs of DVT, which could lead to a pulmonary embolism if untreated. The nurse should assess the patient for DVT and notify the healthcare provider for further intervention. Question 33. A patient post-abdominal surgery has a surgical drain in place. The nurse notes that the drainage has suddenly increased, and the color has changed from serosanguineous to bright red. What should the nurse do first? A. Change the dressing and reassess in 30 minutes. B. Notify the healthcare provider immediately. C. Document the drainage and continue to monitor. D. Apply gentle pressure to the area to stop the bleeding. Answer. B. Notify the healthcare provider immediately. Rationale. A sudden increase in bright red drainage from a surgical drain suggests active bleeding, which could indicate hemorrhage or a complication such as a vessel rupture. The nurse should immediately notify the healthcare provider to address the potential complication. Monitoring and dressing changes are secondary to reporting the issue. Question 34. A patient who underwent abdominal surgery is now experiencing severe epigastric pain and nausea. The nurse notes a decrease in bowel sounds. What is the most likely cause of these symptoms? A. Bowel obstruction. B. Postoperative ileus. C. Peritonitis. D. Gastroesophageal reflux disease, GERD. Answer. B. Postoperative ileus. Rationale. Postoperative ileus, a temporary cessation of bowel motility, is a common complication after abdominal surgery. It can lead to nausea, epigastric pain, and a decrease in bowel sounds. The nurse should assess the patient's abdominal status and initiate measures to manage ileus, such as early ambulation and appropriate fluid management. Question 35. A 40-year-old patient post-lung surgery is experiencing a significant drop in oxygen saturation and increased work of breathing. What is the first action the nurse should take? A. Administer a bronchodilator as prescribed. B. Increase oxygen flow to the patient and assess lung sounds. C. Notify the healthcare provider of the patient's status. D. Perform a focused respiratory assessment and prepare for intubation if necessary. Answer: B. Increase oxygen flow to the patient and assess lung sounds. Rationale: the first priority is to ensure the patient receives adequate oxygenation, so the nurse should increase the oxygen flow and assess lung sounds to determine if there is a respiratory complication, such as atelectasis or pneumothorax. Intubation and notifying the healthcare provider come after addressing the immediate need for oxygenation. Question 36. A post-surgical patient with a history of chronic alcoholism begins to exhibit tremors, confusion, and agitation 24 hours after surgery. What should the nurse suspect? A. Acute withdrawal syndrome. B. Hypoglycemia. C. Post-operative delirium. D. Sepsis. Answer: A. Acute withdrawal syndrome. Rationale: chronic alcohol users are at risk for acute withdrawal syndrome, especially in the postoperative period. Symptoms such as tremors, confusion, and agitation typically appear 12 to 48 hours after the last drink. The nurse should implement withdrawal protocols and notify the healthcare provider for appropriate management. Question 37. A post-operative patient is experiencing sudden and severe lower back pain, difficulty urinating, and loss of sensation in the lower extremities. What should the nurse suspect and prioritize? A. Acute urinary retention. B. Spinal cord injury or compression. C. Deep vein thrombosis, DVT. D. Acute appendicitis. Answer: B. Spinal cord injury or compression. Rationale: sudden severe lower back pain, difficulty urinating, and loss of sensation in the lower extremities are classic signs of spinal cord injury or compression. This is a medical emergency that requires immediate intervention to prevent further neurological damage. The nurse should immobilize the patient and notify the healthcare provider immediately. Question 38. A 50-year-old patient is recovering from abdominal surgery and is experiencing persistent nausea, abdominal distension, and vomiting. What is the priority nursing action? A. Administer antiemetic medication as prescribed. B. Assess for signs of bowel obstruction and notify the healthcare provider. C. Encourage the patient to drink fluids to prevent dehydration. D. Change the patient's position to alleviate discomfort. Answer: B. Assess for signs of bowel obstruction and notify the healthcare provider. Rationale: persistent nausea, abdominal distension, and vomiting after abdominal surgery raise suspicion for bowel obstruction, a serious complication. The nurse should assess for signs of obstruction, such as high-pitched bowel sounds or lack of stool output, and notify the healthcare provider immediately for further evaluation and management. Question 39. A 72-year-old patient who has just undergone hip replacement surgery is experiencing dizziness and fainting spells. What is the most likely cause of these symptoms? A. Blood loss from the surgical site. B. Orthostatic hypotension from anesthesia. C. Deep vein thrombosis, DVT. D. Cardiac arrhythmia. Answer: B. Orthostatic hypotension from anesthesia. Rationale: orthostatic hypotension is a common post-surgical complication, especially following anesthesia. The patient's dizziness and fainting spells are likely due to a drop in blood pressure when changing position. The nurse should assist with ambulation and monitor the patient for signs of further hypotension. Question 40. A patient recovering from spinal surgery complains of severe headache, visual disturbances, and nausea. What should the nurse suspect and prioritize in the assessment? A. Migraine headache. B. Cerebrospinal fluid leak. C. Postoperative hypertension. D. Acute intracranial hemorrhage. Answer: B. Cerebrospinal fluid leak. Rationale: a severe headache, visual disturbances, and nausea following spinal surgery suggest a cerebrospinal fluid (CSF) leak, which is a potential complication of spinal procedures. The nurse should assess for signs of a CSF leak, such as clear fluid drainage, and notify the healthcare provider immediately for intervention. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.